As medical students in our first couple of years, traditionally you do basic sciences, like I've been talking about in some of my videos, but we also get some exposure to the clinical aspects, um, just really basic stuff. So at my campus, we all get a physician mentor within the community that we meet with and learn how to take patient histories, which is basically just uh, asking the questions correctly to learn what you will need to know, a background you will need to know about a person to figure out how you can help treat them. I don't know if that's like an accurate definition of a patient history, but it's the best way I would know how to explain it to you if you've never heard of what one is. Maybe I'll have a better explanation at the end of the semester or year when I can take one better myself. Anyway, so patient history is like the foundation of medicine. What I did want to talk about was just my experience going back into a clinical setting. So I got to meet with my preceptor for the second time today and spend some time with her going around her family medicine clinic. And it's really great. It really takes me back to my time during my gap year when I worked in a family practice office and seeing patients and being in that setting again, but actually having more knowledge now. Before, when I shouted physicians as a pre-medical student, I think uh, I followed them, and I paid attention and I kind of knew what was going on. But as a medical student, it's like I even amazed myself at how much more aware I am, even just in the things that I have learned over the past 2 months. How much more aware I am basically of what is happening in the physician patient interaction. And so I pay a lot more attention, and frankly, I think it's a lot more enjoyable. So even after an exam block, not long after, it feels like we already have a lot of things to study, and you're studying all of the time, and you're at least for me, you're still just barely or not really to where you want to be. And so you're just like swimming through all of this dense material, trying to master it as you go. And I think this having these little bits of clinic put in at really the right amounts. I think any more of it, if we were doing too much stuff, it would just be too overwhelming, I think, to handle that and the basic science core classes. And then like I think in our basic science core classes there is a good amount of like when we're learning actual science material, incorporating in the clinical application when it is taught to us. I think that they're doing a pretty good job of that. But like actually seeing a physician in action and actually seeing patients come in with different issues and actually seeing how the process of coming to assessing a problem and coming to a diagnosis and forming a plan and building a relationship with a person is really important to keep in mind and see while all of the other stuff is going on through your first and second year of medical school, because it reminds you why you're doing the intense stuff in the first place, and it's to get to that other place. It's because the clinical setting is where you will be, and all of this is just preparation for that. And so it's I guess, like, for me anyway, it's a good motivation. It makes me, I feel like every time I think the preceptor visits are something that make me feel renewed and motivated. So that's good, because it's important, I think, as a student, especially as a medical student, to find things that will motivate you and be aware of like what motivates me, so that you can go to that thing and find it. And like, I know I won't be able to just like shadow a doctor all the time. I don't have time for that. But like, at least to read something or think of something or do something that will remind me of the clinical application, the clinical significance of something I'm learning, that will re-excite me to continue to work hard and learn it.